So now let's study about one of the important platelet disorder, that is wiskott-Aldrich syndrome. So without getting delayed, let's get started. It is an X-linked recessive disorder. It's a very important point to be noted. I'll stress upon this. It is an X-linked recessive disorder, which means that the defect in the X chromosome, and that is why the males will be most commonly affected because they're having only one X chromosome, whereas females will be usually the carriers because they'll be having another one X chromosome which can be normal. Here it mainly affects the VAS gene, which codes for VAS protein, and it is very important for signal transduction in the immune cells, and hence a wide variety of cells are affected like T lymphocytes, dendritic cells, and platelets. But most importantly, the cells which are affected are the T lymphocytes. When these T lymphocytes, which are the most important immune cells of the body, are affected, the further processes after which take place after the T cell maturation, like phagocytosis and the production of chemokines, which is important for the immune system to function properly, are affected. As a result of that, the patient's immunity will decrease to a very much extent. Here, when I say the patient, it is a child which comes to you because of the decreased immunity. You can see the patient presenting you at a very young age, that is a child who is presenting to you. Can you guess the clinical features without seeing the slide? Just by knowing it is a platelet disorder, what is the clinical feature which you can expect the patient to present with? Yes, as you know, there is a clear distinction between the clinical features with which a patient with platelet disorder comes to you and a patient with coagulation disorder comes to you. Yes, the patient with platelet disorders like wiskott, Aldrich, ITP, TTP, the presents with petechiae, epistaxis, bruise, purpura, and rash. These words typically will be there in the history and in the presentation, whereas a patient with coagulation disorders like hemophilia usually presents with hemarthrosis. Any clinical history having this word hemarthrosis indicates that the patient is having coagulation disorder. So in MCQ exam, this is one of the important key points which can help you differentiate between platelet disorder and coagulation disorder. Hence, you can rule out the options. And the next clinical feature is, as I already said, the patient will be having very much decreased immunity because of the defective T lymphocytes. That is, the T lymphocytes cannot mature, and the further process of the immune system will not take place, and hence the patient presents to you with recurrent infections, which can be recurrent pneumonia or any other infections. Next most important clinical feature is the thrombocytopenia with small platelets. The importance of thrombocytopenia is that the patient must and should have thrombocytopenia to call it as a wiskott-Aldrich syndrome. The normal platelets itself with any all the clinical features, but normal platelets rule out wiskott-Aldrich syndrome. This is an important clinical feature of wiskott-Aldrich syndrome. This question was also recently asked in NEET SS examination. So thrombocytopenia is a very important clinical feature of wiskott-Aldrich syndrome, and the normal platelets rules out the wiskott-Aldrich syndrome. And the patient typically will be having small platelets, and this word small platelets will be also very important in your exams when you see the history. There will be decreased IgM levels and increased IgA and IgE levels, which may be due to some atopic etiology which is present in this. There is also a poor humoral response to the polysaccharide antigens, and as I already said, because of the decreased immunity, the patient, that is usually a child, will be more prone to autoimmune disorders, recurrent infections, even some of the cancers like lymphoma and many others. But the confirmatory test is for any conditions where the gene is affected. The confirmatory test will be always detecting that genetic mutation in that particular chromosome, and here so to test for the VAS gene mutation of the chromosome X, and this is the confirmatory test. If it is present, then it is confirmed that the patient is having the wiskott-Aldrich syndrome. Coming to the management, there can be many other conservative management like giving prophylactic antibiotics, preformed immunoglobulins, but the definitive management is the stem cell transplant. Gene therapy is also being tried, but until now the effective treatment which is found is the stem cell transplant. When coming to the prognosis is usually poor. Without any aggressive treatment, most of the patients can die by the age of 15 years because low immunity will give rise to variety of very serious infections just like HIV, which can be life threatening and which can lead to the death of the patient. So this is about the wiskott Aldrich syndrome. To sum up, it's an X-linked recessive disorder where there is a mutation in the VASP gene which codes for the VASP protein, which is important for the immune system to function. So because of this defect, there will be irregular T cell formation and the whole cascade of immune system will be affected, and the patient presents with eczematous rash, recurrent infections, and thrombocytopenia with small platelets. The patient can develop many other complications like severe autoimmune disorders, viral infections, lymphoma, and many other life threatening conditions. And the management is the hematopoietic stem cell transplantation, which is a definitive management. So, thank you. Thanks for watching. Please like and subscribe to the channel for further more such educational videos. Thank you.